Let's talk about Ozempic face, what it is, how to prevent it, and how to treat it. I'm Dr. Rupal Mather, board certified in internal medicine and a weight loss specialist, and I have patients that come in all the time telling me they don't want to be on one of the injectable weight loss drugs. And by that I mean one of the GLP-1 medications like semaglutide, which is also Ozempic and Wegovy, or tirzepatide, which is also Mounjaro and Zepbound, because they don't want to get Ozempic face. Let's be clear, Ozempic face just means weight loss in the face in people who are taking Ozempic. There is nothing specific that Ozempic or any of the drugs in that class of medication does to cause wrinkles in the face. The fact of the matter is, if you want to lose weight, you will lose weight in your face and your wrinkles will show more. So how can we prevent Ozempic face? Aim for slow and steady weight loss. I like for my patients to lose about 4 to 6 pounds per month. Yes, some months, especially at the beginning, will be much more rapid than that. But in general, that slow, steady rate of loss is a lot more sustainable, and it actually means fewer wrinkles because that gives your skin time to recontract as you're losing weight, which leads to less loose skin and fewer wrinkles. The second thing to do to prevent wrinkles is something you probably already know. Wear sunscreen. In particular, use sunscreen that blocks both UVA and UVB rays. The UVB rays are the ones that are harmful and can cause skin cancer, but the UVA rays are the tanning rays that can lead to increased wrinkles. Now, for many of you on a GLP-1 medication, preventing wrinkles is not as much of an option as it is to treat wrinkles. So how do we treat wrinkles? The number one undeniable best product to treat wrinkles is tretinoin. Tretinoin is retinoic acid. It's a vitamin A derivative that you put on your skin. It's a prescription-only medication, and it has been proven time and time again to reduce and reverse wrinkles. But you can also take over-the-counter Adapalene, which is also a retinoid, but it's much gentler on the skin, and it's available over the counter without a prescription. Adapalene is something that I use topically for acne and for wrinkles. I know I look young, but I'm almost 40. There are 2 other topical creams that can help reverse and reduce wrinkles or Ozempic face. The next one is vitamin C, and you can get a lot of products with vitamin C derivatives in them. The gold standard is SkinCeuticals. That one's relatively pricey, and you don't have to go with something as expensive as long as it contains vitamin C. And the last topical skincare ingredient I recommend is niacinamide. That's a derivative of vitamin B3. Niacinamide has also been shown in multiple studies to reduce and reverse wrinkles. It's important to note that tretinoin can increase photosensitivity, which brings us back to our first point that you want to use sunscreen while you're using these other topical medications. If you are postmenopausal, there is one other medication that can really help topically, and that is estrogen. This is something that I'm seeing more and more dermatologists prescribe. Topical estrogen, it can even be vaginal estrogen. It's applied under the eyes, on the neck, and on the tops of the hands. However, remember that topical estrogen is systemically absorbed, so you have to be a good candidate for using estrogen in general. So remember, Ozempic face just means weight loss in the face. And weight loss in the face can reveal the wrinkles that you already have, but using the skincare regimen we talked about, you can handle that.